Okay, so today's topic for general anatomy is circulatory system. The circulatory system comprises of the blood vascular system and the lymphatic system. The blood vascular system has the blood flowing through the system, and the lymphatic system has lymph instead of blood flowing through it. Now, blood vascular system is further subdivided into different types of circulations. Number one is the systemic circulation. Number two is the pulmonary circulation. Number three is the coronary circulation. And the fourth one is portal circulation, which is further subdivided, and we'll discuss it later on. Now, systemic circulation is the one in which what happens, the oxygenated pure blood flows out of the heart through the aorta and it goes and revolves around the body and supplies oxygenated blood to different organs and systems of the body. And the deoxygenated blood is returned back to the heart through the superior and inferior vena cava. So, this system of circulation is called the systemic circulation. In this picture, we can see that this circuit, starting from heart, left side of the heart, circulating through the entire body, and then returning to the right side of the heart, is called the systemic circuit or the systemic circulation. Next is the pulmonary circulation. The pulmonary circulation is restricted to the heart and the lungs. What happens is that the deoxygenated blood that was returned back to the heart, right side of the heart, goes through the pulmonary arteries into the lungs. This blood is oxygenated in the lungs, and the oxygenated clear blood is returned back to the left side of the heart through the pulmonary veins. And this oxygenated blood is then circulated through the entire body through the systemic circulation that we have discussed before. So the part of the circuit where the blood deoxygenated blood goes from right heart to the lungs to and then oxygenation, and then the oxygenated blood returns to the left heart. This circuit is the pulmonary circulation. Next is the coronary circulation. So what happens in coronary circulation is that, as the name indicates, coronary is for the heart. So it is the blood supply of the heart, the circulation around the heart. So the heart has the right coronary artery and the left coronary artery. The right and the left coronary arteries gives off various branches, and then they anastomose at some points, and then they supply the heart muscle. So this is the coronary circulation. The fourth one is the portal circulation. Our usual circuit of blood supply is starting from the arteries to the arterioles to capillaries to venules and finally to the veins. Portal circulation is the one in which we have two sets of capillaries. This is one capillary bed and this is the second capillary bed. What happens is that the blood from the arterial circulation goes to the arteriole, enters first capillary bed, then through a vein enters the second capillary bed, and then finally to the venule and the venous circulation. So this dual capillary bed system is called the portal circulation. Now, the portal circulation is of venous and arterial type. First of all, we'll discuss the venous portal system. The first example for venous portal system is the hepatic portal circulation. The word hepatic is for liver. So what happens is that the arterial blood goes to the stomach and intestine. This is the first capillary bed. Then through the hepatic portal vein, it enters the second capillary bed, which are the sinusoids in the liver. And from here, the blood enters via hepatic vein to the venous system. This is the hepatic portal circulation. Next example of the venous portal system is the hypothalamo-hypophyseal portal system. This is the system that circulates in the hypothalamus and then the pituitary gland. What happens is that the blood from the hypothalamus enters first capillary bed, then it enters through a major vessel into the second capillary bed, and finally it enters into the collecting vein. This is the venous portal system. Now we'll discuss the arterial portal system. What happens in arterial portal system is that this connecting vessel between the two circulatory beds is an artery. So here you can see that this interlobar artery, it gives an efferent arteriole. This is the first capillary bed. The efferent arteriole arises and then it enters the area of the peritubular capillaries. This is the second arterial blood capillary bed, and then the blood enters into the renal vein. This is an example of the arterial portal system. Now we'll briefly discuss the structure of blood vessels. Blood vessels have three layers. Innermost is the tunica intima, middle one is the tunica media, and outermost is the tunica adventitia. Tunica intima has an endothelium, a subendothelial connective tissue, and a layer of internal elastic lamina. Now, tunica media is the middle layer and it has smooth muscles. Histologically, it is comprised of smooth muscles, and this is the middle layer. The outermost layer is the tunica adventitia. It has collagen, elastic fibers, vasa vasorum, and nervi vasorum. Now, the major differences between arteries and veins are that the arteries have oxygenated blood, except for the pulmonary and umbilical arteries, which carry deoxygenated blood. And the veins carry deoxygenated blood by default, except for the pulmonary and umbilical veins. And the other difference is that arteries have no valves because the blood has to flow in according to the gravity, and the veins have valves because the blood has to flow back towards the heart against the gravity, so the valves prevent the backflow of blood. In this picture we can see the three layers comprising of the vessels: the intima, media, and the adventitia. Now we'll discuss the classification of blood vessels. The blood vessels are classified anatomically into arteries, arterioles, capillaries, venules, and veins. Elastic arteries or large arteries have a larger diameter, that is 73,000, and they conduct blood. And examples are the aorta, pulmonary artery, subclavian artery, the common iliacs. Next is the medium artery or the muscular artery. It has a diameter that is slightly less than the large artery. They distribute blood into the regional vessels, and their example is the radial artery, the ulnar artery, and the femoral artery. Next are the small sized arteries. They have further smaller diameter and they help in the distribution of blood to the arterioles. Now, muscular arterioles provide resistance to the blood flow and they have a diameter of only 50 to 100. Terminal arterioles are also called the resistance vessels. They have only one layer of smooth muscle in their wall and they are the major determinant of blood pressure. In this picture, we can see this is the arteriole and this is the venule. In between is the arteriovenous channel, which is surrounded by the capillary bed. Met arterioles are the ones where terminal arterioles further branch and form the metarterioles. They have a layer of smooth muscle, but that is discontinuous. And a specific important characteristic of metarterioles is that they have a precapillary sphincter, which allows the blood to flow in one direction. Next are the capillaries. The capillaries are also called the exchange vessels. And they have a lumen of 5 only, and they help exchange between tissue fluid and the blood across such vessels easily occurs. The various types of capillaries are the continuous capillaries, the fenestrated capillaries, and the sinusoidal capillaries. The continuous capillaries have no pores or gaps, and they are present in the muscle, lung, and brain. The fenestrated capillaries have pores in their lining endothelium and they are present in intestine, endocrine glands, and the kidneys. The sinusoidal capillaries have intercellular gaps and pores and they are present in liver, spleen, and bone marrow. Now, what are preferential thoroughfare channels? In this picture, we can see that the blood from the arteriole enters a capillary bed, which enters into the venule. There is another pathway where the blood from the arteriole directly enters into the venule. This is called the thoroughfare channel. This is an alternate route for blood flow. In this picture, we can see that this is the arteriole and this is the venule and these are the capillaries. But here, this is a direct flow of blood between the arteriole and the venule. This is the preferential thoroughfare channel. The post-capillary venules are where 2 or 3 capillaries meet and they form a post-capillary venule. Small sized veins, medium sized veins, and the large sized veins, all of these act as reservoirs of blood. Example of large sized veins are the superior vena cava and the inferior vena cava. In this picture, we can clearly see the elastic or large artery, the muscular or medium artery, and the arteriole or small artery. Here we can see the large vein, the medium vein, and the small vein or the venule. And this one is the capillary, which has a single layer of smooth muscle. Up till now, we have discussed the anatomical classification of blood vessels. Now we'll briefly discuss the functional classification. It has 5 categories. The first one is the conducting vessels, and the example is large or elastic arteries. Next is the distributing vessels, and the example is muscular arteries or medium-sized arteries. Next are resistance vessels, and the example is arterioles. Another one is exchange vessels, and the capillaries and venules make the exchange vessels. And finally are the reservoir vessels in all the veins, the small, medium, and large. All veins lie in this category. The neurovascular supply of blood vessels is called the vasa vasorum and the nervi vasorum. So what happens is, generally for small arteries and veins, the blood supply is through diffusion. But for large arteries, the lumen is so big that simple diffusion is not enough for the supply of nutrients. What happens is that the large arteries have their own blood vessels and their own nerves. So the blood vascular system of the artery vessel is the vasa vasorum, and the nervous supply is called the nervi nervosum. Now we'll briefly discuss the types of anastomosis. Anastomosis is a communication between vessels to form the collateral circulation. The three types of anastomosis are the arterioarterial anastomosis, that is between the two arteries, the arteriovenous anastomosis, that is between the artery and the vein, and the veno-venous anastomosis, that is between the arteries and between the two veins. Now, arterioarterial anastomosis is the one where two arteries join. An example is the anastomosis around the knee joint. This is a very important example of collateral circulation at the level of joint. Now, the arterioarterial anastomosis further subdivided to another type, that is called the actual anastomosis. What happens in actual anastomosis? That the blood is actually flowing through the anastomotic channel. So there are three types of this type of anastomosis. The first one is transverse anastomosis. What happens is that the two vessels, longitudinal vessels, are met in between somewhere through a branch that lies transversely. Example is the anastomosis between the radial and the ulnar arteries. Another is the end-to-end anastomosis. Here, the end arteries of a major artery connect with each other to form a collateral circulation. For example, the superior labial branch of the facial artery of the right side joins with the superior labial branch of the facial artery of the left side to form an anastomosis on the upper lip. Same is the case with inferior labials of the two sides, which make an anastomosis on the lower lip. This is an example of end-to-end anastomosis. Finally, the third one is the convergent anastomosis. In this type of anastomosis, two vessels, for example, we can see here the vertebral arteries of the right and the left side, converge in the center to form the basilar artery. This is an example of convergent anastomosis. Then we have the potential anastomosis. First, we have discussed the actual anastomosis. What happens in potential anastomosis? That normally the blood is not flowing through this anastomotic channel. But in case of some ischemia or blockage of a vessel, blood flows through this anastomosis. Example is the coronary circulation. And here the potential anastomosis occurs on the surface of the heart. Next is arteriovenous anastomosis. This is an anastomosis between the arteriole and the venule, and this is called the arteriovenous shunt. Next are the end arteries. End arteries are the arteries that do not make any anastomosis, and the blockage of such end arteries leads to ischemia or death of that specific structure. Important example is the central artery of retina. This is an end artery. That's all for today. Thank you.